All right, good afternoon, Dr. Fleming. How are you doing today?
I'm fine. How are you?
Doing okay. So today is our first blog post. We're excited. I wanted to quickly introduce myself, Ashley Gomez, Strategic Partnerships here at Cayaba Care. And then I am lucky to be interviewing and doing a Q&A with you, Dr. Fleming, an OBGYN and Medical Director for Cayaba Care. Anything else you would add?
No, I think I'm excited about this opportunity to start talking to our potential um, customers, clients, consumers out there, and get a little bit more information about ourselves and what we're doing, and hopefully share some valuable information for pregnancy and during the breastfeeding and lactation time as well.
Awesome. So here at Cayaba, we're focused on providing an extra layer of support to expecting mothers throughout their maternity care journey. And so as we listen to patients, more and more we hear a bit of angst and concern around not only COVID-19, but the vaccine itself. So Mary, you've been seeing patients. What have you been hearing in terms of the vaccine or concerns from expecting mothers?
Well, I think it's important to, still contextualize that COVID-19 is still itself is still new to us, and the vaccine is even newer. And so I think it is very fair and normal to be concerned about both the virus and the vaccine, and that you should ask questions. You should understand the medication, why we're recommending the medication, why it's the best option for you, or why it may not be, because there will be a few people that it's not the best option for. And so in talking to moms, generally, they just want to know, is it safe, and is it safe for their baby? And that's the general question with most pregnant moms. And when we talk about medications of any kind, right? They just want to know if it's safe, and if it's safe for them and for their baby, and if there are any long-term effects, especially with everything being so new.
Mm-hmm. And so how do you approach that conversation? Like, I guess let's get right to it. Is receiving the COVID-19 vaccine safe if you are pregnant?
So it is considered safe. The studies, like most things, again, in pregnancy, we don't do a lot of specific clinical trials and research on pregnant women, but we use the information that we have from previous vaccine trials. We use information that we have for women that we found out after the fact who have been part of the vaccine trial. And then we use information from women who received the vaccine during pregnancy and followed their journey through the rest of the pregnancy after it had been approved and distributed. And so from the information that we have, everything looks like it's safe, and all of the recommending bodies are recommending the vaccine for pregnant moms.
Awesome. And in terms of side effects, if women are experiencing headaches, fatigue, can you talk to how one should think about the side effects?
So as far as we can tell, the side effects are the same for pregnant and non-pregnant people. So the common things around headaches, fatigue, soreness at the injection site, some fevers, chills are common, usually very self-limiting, may last less than a day or two, respond to Tylenol, which is what we would recommend to take in pregnancy.
Awesome. Okay. And so we talked a little bit about pregnancy. What about for those who are breastfeeding or lactating? Can they receive the vaccine as well?
The recommendation is the same for pregnant, breastfeeding, and lactating moms. So we don't think it poses any concern to mom, to baby, or again, any long-term effects.
Okay, awesome. And so once folks are getting vaccinated, are there any additional measures, or what would you like to continue to see in your patients?
So we, as we started off talking about, this is still new, and we know how viruses work in general, right? They're spread from person to person. So as much as we can decrease the community spread that's still out there, we want to work to do that. So that means just continuing to wear your mask, continue to social distance as appropriate, continue to wash your hands, stay out of high-risk situations that you can identify ahead of time. And so that we want to work towards reducing the viral load, both by getting the vaccine, but also, reducing the community spread with these more normal everyday measures, if you will.
Yep. Okay, awesome. Well, thank you so much, Dr. Fleming. Really appreciate the quick insight. And anything you would leave your perspective or current patients with?
I guess the only thing we really didn't talk about that, we talked about why people might be nervous about the vaccine. And we know that there are certain populations that historically have been a little bit more nervous than others. And that can be for a couple reasons. We know that there is still an element of distrust in the medical community around particularly vulnerable or more marginalized populations. And we also know the burden of COVID-19 has been higher in those same populations. And so it's really important that we continue to spread as much positive and accurate information that we can around the vaccines so that these high-risk populations continue to be served. And like I said, as far as we know, we're looking at all the studies that we have, looking at both this recent data and long-term data that we've gotten from previous vaccine trials and vaccine administration. There's nothing to think that this vaccine is unsafe. There's nothing to think that you're getting anything other than the vaccine when you're getting it. And there's nothing to make us think that there are any long-term side effects or consequences that aren't associated with any type of medicine or vaccine that you might get. There's always going to be side effects, but the side effects are very low, and the side effects in this particular vaccine are no different than any of the other vaccines that we normally administer.
Gotcha. No, I think it's a really good call out. I think, as we hear from our patients, whether it's their previous medical history, historic experiences with the healthcare institutions, views in the vaccine vary. I think it's doctors like you and our clinical team that help put those worries and questions at ease. So really appreciate your time, Dr. Fleming, and looking forward to having more conversations.
Of course. Thank you.
Awesome.